the Health and Human Services Committee of the Wayne County Commission to order here. Happy COVID, everyone. Madam Clerk, would you call the roll, please?
Commissioner Marecki?
Here.
Oh, good.
Commissioner Daub?
Here.
Commissioner Anderson?
Here.
Okay, I thought I saw your name on here. Commissioner Baker McCormick?
Here.
Chair Colleen?
Yeah, I'm here.
You have a quorum present.
Thank you, Madam Clerk. What's next on the agenda?
B, approval of the September 8th, 2020 meeting minutes.
Moved by Anderson.
So moved. Support Baker McCormick.
You got that, Madam Clerk?
I got Baker McCormick supporting who?
Anderson. Anderson moved.
Gotcha.
Are there any additions, corrections, changes to the minutes? Hearing none, all in favor of the motion, please say aye.
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 Opposed? Abstentions? All right. Before we go to old business, Madam Clerk, I've got to clean up a little committee business here. As we stand right now, folks, on the addenda, we have Commissioner Baker McCormick's resolution on lead that just got finished by staff. And it will, we will have it on our screens because they didn't have enough time to get it to committee by email. So we will have a discussion. We do have a presentation, and we will have a discussion and a vote on that ordinance, but it'll be on the ordinance, on the resolution, but it will, you won't have paperwork on it. It'll show up on your screen. In addition, we have, I think it's 11 youth assistance, youth, what is it? YAP. Yeah, youth assistance programs. Those contracts start on October 1st, but they are not ready yet. The other contracts that start on October 1st are our care maintenance organizations, our CMOs, the 5 CMOs that do a lot of the juvenile justice services out there. Those are being worked on and finalized now. I don't know if they're going to be ready for the meeting, but I think a little later in the meeting, we're going to have to decide whether we want to adjourn today's meeting for maybe an hour while paperwork is finished, or that we schedule another meeting before October 1st just to deal with those issues of the YAP.
Commissioner Colleen, this is Julian.
Yes, sir.
It's been suggested that we just do that, go ahead and do the special meeting so that we can address all of them at the same time instead of, you know, piecemealing them, I guess.
Yeah, the YAP and the CMOs,
exactly,
Mr. Rainwater?
Yes, sir.
But I think we can handle the lead resolution today.
Yes, yes, sir.
Okay, so we will have to have another meeting then before October 1st. We'll do it by email. We'll get it around and see when people want to do it. I don't want to do that. Try to figure that out on the floor today. So I think that's all the pre-meeting stuff. You know, in these times of COVID, everything slows down, everything's harder to get done. And I think all committees are getting used to addendas just because that's the way it is. I think that covers it. And I think at this point, I want to, for the old business item, I want to turn the chair of the committee over to our vice chair, Commissioner Baker McCormick, to chair this section of the meeting because I want to introduce the ordinance. So if that's good by folks, let me turn the chair over to Commissioner Baker McCormick for old business. You ready, Commissioner?
I am.
Okay.
So we'll go ahead and move to the new business.
Old business.
Old business item, I'm sorry.
Yeah.
Madam Clerk?
One second, I'm sorry. Item C1 under old business is an ordinance by Commissioner Killeen to ensure the human and civil rights of all people are protected against discrimination of any kind in Wayne County by adding Chapter 55 to the Wayne County Code of Ordinances to be known as the Wayne County Human Rights Ordinance.
Commissioner Killeen, you can take it away.
Thank you, Commissioner. I would like to move the ordinance for approval today. It's been a little bit of a time getting here to get this done. There are a couple of changes which I will ask Commission Counsel to discuss in a minute here. But in terms of introducing this, I want to thank Commission Counsel, in particular Counselor Regina Jones, who did a lot of the legwork on this. I also want to thank Corporation Counsel for their counsel and support of this ordinance. I want to thank Fair and Equal Michigan as well as Equality Michigan for their input on this, as well as the Detroit Realtors and the Grosse Pointe Realtors that had some input on a section of the ordinance that does involve real estate when it gets to housing discrimination. So I want to have all those thank yous out there. In introducing this ordinance, I think the section 55.2 for the purposes that are written into the ordinance, I think say it all. It is the intent of Wayne County that no person shall be denied equal protection of the laws. No person shall be denied the enjoyment of his or her civil or political rights or be discriminated against because of actual or perceived race, color, ethnicity, religion, national origin, sex, age, height, weight, family status, condition of pregnancy, marital status, physical or mental disability, sexual orientation, gender identity, HIV status, veteran status, or political affiliation. Nothing in this chapter shall require preferential treatment of any person or group on the basis of any of the classes protected under this chapter. So I think that says it all. I have a list of about 45 or so. The list keeps changing. They didn't have Grosse Pointe Park on there, but it's about 45 jurisdictions within the state of Michigan that have passed human rights ordinances, and Grand Rapids was the last one, well, one of the last ones to pass an ordinance, a human rights ordinance. So these are very common. I also want to comment that there is an effort right now to get to the ballot to amend the Larson-Elliott Act from the 70s, which is Michigan's Civil Rights Act. Now, some of you might be old enough to remember Mel Larson or to have been around. He is in support of the ballot initiative that would add the language to the Elliott-Larson Act for protections for the LGBT community. So I just want to read his little statement. It was Mel Larson, a Republican, and Daisy Elliott, for those of you that go back far enough, is the Elliott from Detroit, that passed the Elliott-Larson Civil Rights Act to ban discrimination, says Mel Larson. As one of the original authors of this law, I can state unequivocally the intent was to offer the broadest possible protections against discrimination of any kind. It's clear today that Michigan's landmark civil rights law does not go far enough. And he goes on to discuss some other things. But the last I heard, they were about 100,000 signatures short on making the ballot this year. So having this ordinance depending on what the state does. If they amend Elliott Larson, then the protections are going to go statewide for everybody. That may or may not happen this year, but I think it's appropriate at this time that we say Wayne County is the kind of place people can come and live and work and raise families and do whatever without concern for their employment, for their housing, that they might be discriminated against because of who they are. The only real major change, there's a few secretarial changes to the ordinance from last time, but the major change here has been we removed the section with regards to bathrooms. And I would like if Commission Counsel, Ms. Johnson, can you discuss what it was that we decided to pull that out of the ordinance at this time?
Yes, so a couple of points. Your motion should be as amended when we get back to it and get support.
Correct.
Second, commissioners, yesterday morning you received a copy of a red line version with all the revisions, and they were red lines, so they were clearly highlighted. I think the clerk may be trying to put that on the screen right now for everyone to see.
Yep.
With regards to the locker room, in the original version, we had an exception, which would have meant that that would not be covered. We actually took that exception out. So if you look at section 5516, you'll see that that is no longer there, which means it is an area that is protected, that is consistent with the trend in the law. So we are on point with regards to where the law is going with regards to bathrooms and who can use them. So we actually just eliminated the exception, so it's no longer an issue.
All righty, thank you. And if you can stop the scrolling right there, please. It is a red line strikeout version you got, but as you see right at the bottom of section 55.3, there's also a couple of additions. And so you will see a few of that in your version as well. Section 55.3 does give the option for the home rule powers of cities and townships, which actually override county ordinances under Michigan law, that they cannot, a local city or a township can now opt out of this ordinance by adopting an ordinance or a resolution of their own. So that's in there as well.
Yeah, and that's language that we have in all of our ordinances. So
Right.
that is not specific to this, but it's just something that we do to recognize the powers of the other locals. You'll find that some of the other changes were based on definitions, based on comments from the June meeting. We were asked to look at trying to expand some of the definitions. So we did that, and we addressed, adding gender, adding disability, just to make clear those concerns. So we hope that we addressed all of those and expanding the definition of minority. Corp Counsel had a few concerns. We also addressed those items in this particular document. Yes, I'm sorry, Commissioner. Yes.
Oh, thank you very much. And I want to, does Corporation Counsel have any comments at this point? I'm going to move this version in a second. But I want to see if Corporation Counsel has any comments it wants to make at this point. Okay.
Yeah,
that,
I'm not sure if they're on the line, Commissioner, but I can definitely make sure that they get a copy of this revised version.
Yeah, well, they
didn't have any comments prior to the meeting, but I can
Right.
follow up if you would like.
I would, yeah. So with that, Madam Chair, because what we put on the floor and been carrying along under old business did not have these changes in it, I would like to move this version as a substitute for the previous version. I would like to put this version on the floor. So I'm moving to accept this version of the latest version of the proposed ordinance. I move it for our approval, substitute this one for the previous one that we had. So I
Right.
think I did that right, and that's my motion.
Support by
Okay, is there support?
support
It's
Anderson.
been, okay, it's been moved and supported. Are there any, is there anyone opposed? Any abstentions? Motion
Madam
passed.
Chair,
Wait, yeah.
Mhm.
I have a question.
Oh, I'm sorry. Discussion, go right ahead. Mhm.
Okay, thank you. This is Commissioner Dobb, by the way. So I had asked about two definitions in our prior discussion, and I don't think that my suggestions were adopted in this version. And so I just wanted to know if I think maybe Felicia would answer my question, or
So I can. So we did, one of your questions was regard to marital status. We did
Yes.
add separated in there. So we did change that.
Oh,
You
okay.
also had concerns with regards to sexual orientation. So we did also expand that definition.
Okay.
So if you look at the page of your amended version, marital status, I believe, is on page 3, number 15, and then we expanded sexual orientation on page 5, number 24. So yes, your concerns were addressed.
Okay, great. Thank you. I think I'm looking at an old version. I have so much stuff opened up with all the addendas and notes. So, okay, thank you, Felicia.
You got that right.
Madam Chair, I have a question.
Go right ahead, Commissioner Murray.
Thank you. And this would be directed to Felicia. And I didn't write down the section when I was reading this, so I apologize, but it talked about sex-based wage discrimination. What kind of involvement would this commission have over that? And what kind of research would they be involved? I mean, that seems like a very, like a higher level to me than just discrimination about who you are. So
Commissioner, under federal law, the protection, when you talk about discrimination based on sex, it actually does include not only the pregnancy and the childbirth information that we included in the original version, but it also includes sex-based wage discrimination. So that is actually a category that's already included under the protections. And so I just wanted to make sure that our ordinance was comprehensive and covered everything in that category. And so I noticed that it was missing after further review, so we added it in. But it is something that's already covered and considered under federal law when you talk about discrimination based on sex. And it's just, the disparity in wages when you're a woman versus a man, essentially.
yes, okay, I understand that. I mean, that would go to a higher level though if we thought that was happening in the county, right? You're just covering it because it was federal.
I think it falls into the same categories of the other items that someone may complain about to the Human Rights Commission.
Okay.
And their investigation, just the same way for that as they would do for the other complaint.
Oh, okay. It seems like it'd be a harder thing to do, but okay, thank you.
Madam Chair, if I may, also on that discussion.
Commissioner Killeen?
Thank you, Madam Chair. If folks go to Article 3, which is on page 8 of the draft, section 5525, what this ordinance also does is create a Human Rights Commission. And so if there are complaints under this ordinance that are brought forward, we'll go to the Human Rights Commission. It's going to be a 7-person commission. And they're going to be appointed by the county executive and approved by the commission. And you can see what their powers are. But I would like council under section 5526, council, under the duties of the commission, there was some language added as a new I right at the end of it. And I think this goes to the discussion we were just having about wages. So Commission Council, would you like to comment, because there is a little bit of an overlapping jurisdictions here with laws. So Council, would you like to say what the purpose of having I in there is. 5525, 5526, 1I, it looks like.
Yes, so Commissioner, this was actually included based on a comment from Corporation Counsel, a concern. Because we know that there are federal and state protections, we wanted to make sure that people, while you have a right to file a complaint with our local Human Rights Commission once it's created, we wanted to make sure that people were still aware that they had those federal rights and that those federal deadlines as far as timing of when you can file a complaint would run. And we didn't want any, so we want to make sure that we advise them as when the Human Rights Commission advises them that, hey, by the way, the clock is ticking on these other claims if you want to file there for the federal claims. So we added that in there just to make sure that people are aware of their rights. We don't want anyone to lose any other rights that they may have based on filing a complaint with the Human Rights Commission. So this is just us requiring notice so that we can make sure that everyone is fully informed.
And in that case, you won't necessarily have the same complaint going forward in two different jurisdictions, correct?
Right, so we do have a section in, I believe it's the next section, 5527, that talks about not being that this entity won't take up something that you have somewhere else, but we just don't want people to not know that they may miss out on a different claim. So we just want to make sure that as people move forward, they are fully informed about the process and their rights so that there's no confusion.
And we're not in the business of venue shopping here.
Well, we're not, but some people may be, but we won't allow them to do so under this ordinance.
Well, that's what I mean. That's, yeah.
Yes.
That's how it's written.
Commissioner Colleen is
Yeah,
that,
well, I just
okay.
have a motion on the floor for
Mhm.
approving the substitute ordinance.
Okay, the adoption, and then we had support from, did we get support?
Anderson supported it.
Anderson, okay. And we had discussion, is that correct? Any opposition to this? If not, can we get a vote?
Would you like a roll call vote?
Yes, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
I think he had to step away for a sec.
Commissioner Baker McCormick,
Yes.
Commissioner Colleen,
I vote yes.
Did we want to try Anderson again?
Yes.
No?
Yes.
All right. Great. Motion passed. Congratulations to Commissioner Colleen on all your work and effort that you put into this ordinance.
Well, thank you, Commissioner. And of course, what we do here is for the citizens of Wayne County. And hopefully with a positive vote on October 1, we can say to everyone out there, all citizens, that Wayne County is the place you can come and be who you are and not be discriminated against because of that. To me, it's kind of like, you know, the American dream. So thank you, Commissioner.
And I will pass the gavel back to you.
Thank you, ma'am. Madam Clerk, let's go on to new business then, please.
Item D1 under new business, requesting commission approval of a 3-year use and occupancy agreement with 2 one-year options to renew with Garden City School District.
All right, does administration have someone that would like to introduce this item?
Hi. Oh, sorry, it took me a
Hi.
minute there. This is Carol Osterberry from Health Officer, Wayne County Health, Human and Veteran Services. And yes, this is a use and occupancy agreement between Wayne County and the Garden City School District so that we can provide the WIC program services from that school. That is when WIC goes back to being face-to-face.
Okay. How long have we been using the Garden City
We have
location?
used this location for many years. I can tell you certainly as long as I have been here, which is 11 years now.
Okay. We'll go to questions from committee members, and we'll reverse the order this time. Commissioner Marecki, do you have any questions on this item?
No, I don't have any questions on this.
Thank you,
Thanks.
Commissioner. Commissioner Dobb, you have questions?
Yes, is this a retroactive contract?
No.
Okay.
No.
Okay, I think I'm confused on something else in my notes. All right, thank you.
Thanks.
We blame it all on COVID, Commissioner. Commissioner Anderson, do you have questions?
I do. Carol, speaking of, seeing this made me think about something that in many years past in Garden City, they had, the county, I think, had been involved in flu shots and things like that. Are we going to do that as a county where in communities this year?
Right. Very good question. And yes, we are working on our whole, flu shot outreach and, campaign for this year. Absolutely. And yes, we will be, when we get that fully flushed out, those plans will be, put out to everyone.
Yeah, if you could make sure the commission knows, and we'll
Yep.
try to help publicize it. Thank you.
Thanks.
Thank you, Commissioner. Commissioner Baker McCormick, questions on item 2 or item 1?
Nope. No
right.
questions.
As long as we're here, Ms. Osterberry, we haven't had an update from the department, kind of comprehensive on COVID in a little bit. I'm going to suggest to you, Ms. Osterberry, that we, not at the next HHS, but at the one after that, so a month from now.
Okay.
Because we will probably at that point have some sense of second wave in another month. We also might have some sense of if any action is going to come out of Washington, like another bill that might provide some resources, maybe. So I think if we kind of wait a month and let a few of those things shake out, I think then to see where we are with our health department and what's going on out there and what's needed. So if that's possible, Ms. Osterberry, we'll do it in about a month.
Absolutely.
Okay. Thank you. All right, what's the pleasure of the committee on item D1, Garden City WIC?
I'll move approval, Dobb.
Support Anderson.
Oh,
Thank
do you
you.
want to move that, Glenn? I'm sorry.
Sure.
Okay, and I'll support.
I was on mute.
So Commissioner Anderson moves, Commissioner Dobbs support. Any other questions on this? All in favor of the motion then, please say aye.
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 Opposed? Anybody abstaining?
Thanks, Commissioner Dobb.
Okay, so on we go. Madam Clerk.
Item 2, requesting commission approval of modification 2 to a 2-year, 9-month contract with 2 one-year options to renew with WellPath.
Okay. From the administration, what's the modification that we are looking at today? Who's handling this?
Good afternoon. This is Janelle Allen, Chief Operating Officer with the Wayne County Executive's Office. I will be addressing this along with Clinical Services Director Jennifer Caruso, under which Joe Medical Services are managed. As stated, this is exercising the second and last 1-year renewal extension of the original contract. This contract started with WellPath's predecessor, Correct Care Solutions, also known as CCS, and they started providing our jail medical services in January of 2017. The first 1-year extension was exercised last year, and that extension started on October 1st of 2019, and it ends at the end of this month. And so, therefore, we are requesting exercising the last renewal option for the next year. During that year, we are bidding out the contract. In fact, we're working on the RFP as we speak, and we expect to have the RFP issued no later than November. So we have plenty of time to get a new contract in place well before the current 1-year extension expires if approved. Also, last year, after the completion of the OAG audit of the services provided under this contract, the Clinical Services Division developed a comprehensive corrective action plan to effectively address all of the OAG findings. And one of the significant findings we saw was we also enhanced our contract oversight. So Jennifer Caruso, I'd like her to provide an overview and update on the corrective action plan and how we believe that we are fully compliant with that corrective action plan. So Jennifer.
Sure. Hi, everyone. It's Jennifer Caruso, Clinical Services Division Director.
Welcome, Ms. Caruso.
Thank you. Thank you. I would like to provide some updates in the jail health program since my arrival in November of 2019. When I came on board, I believe there were a few audits happening, one of them being the OAG audit. I met with my staff frequently from November through, I believe, January or February, and developed, like Janelle said, an extensive corrective action plan where there were 18 items identified. All 18 items have been corrected on that corrective action plan. In that time, we have also hired a contract service manager for jail health, and she is monitoring the WellPath contract. So we have really enhanced our oversight over the contract for WellPath. We hired Katie Snow, who was our new jail health contract manager. She brings with her extensive experience in quality assurance at Beaumont Hospital. She was a medical assistant there as well, so she's really familiar with clinical operations. She can identify practices, she can identify concerns and quickly wrap her head around those concerns to develop solutions with and in collaboration with WellPath. She does regular chart reviews of the inmates, speaks with the inmates on site. She frequently visits the jail. So these are all changes that we've made in the last 9 months. So we've really come a long way with the oversight of the contract. The main thing that we were able to do is really pay attention to the corrective action plan and closely monitor that month after month throughout this year since the development of the plan.
Thank you, Ms. Caruso. I'm going to ask you on the corrective action plan. By that, do you mean the one that the OAG, the Auditor General, put out, or do you have another corrective action plan that you're working on?
That is correct, the OAG corrective action plan.
Okay. And if I may, this might be the appropriate time to bring in the Auditor General. The corrective action plan is actually going for discussion tomorrow at the Audit Committee. But if the Auditor General would like to make some comments on the corrective action plan in general about what the committee is going to be looking at tomorrow. Ms. Cora, are you ready to discuss a little of that?
Sure, Marcy Cora, Auditor General. In our audit report, we had 22 recommendations, and the department submitted their corrective action plan to our auditors. We went out and we did a thorough assessment of the action taken by management. And of the 22 recommendations, which we'll be discussing in detail tomorrow, 15 of them were determined to be implemented. There was one that was no longer applicable. It had to do with the software change for the passing of the drug medication. And then there were 6 other recommendations that the action we believe will be sufficient to address the recommendation. However, based on the timing, we weren't able to actually do as detailed testing as we would have liked to assess the corrective action, but we believe it will be sufficient. But we may come back later and just do a follow-up on those 6 recommendations. But everything is either in process or been implemented.
Thank
And
you.
like I said, tomorrow we'll go in detail into each of the recommendations.
All righty, thank you. Thank you very much. One other thing before, and I'm going to open it up to commissioners' questions in just a second here. There were some questions prepared by staff in our paperwork that we got. I'm going to caution folks that on items 9 and 10 on there, the questions that were asked, those involve some ongoing legal, which is not up for discussion today. If people want to discuss those questions, questions 1 through 8, but because of ongoing investigations, items 9 and 10 are not proper for us to discuss in a public forum here. So with that, I will go to questions from commissioners. We'll keep the same order. So that means we start with Commissioner Marecki. Questions, please.
You know what? I don't. What time is the audit meeting tomorrow? I'd like to hear more.
9:30 a.m. That'll get you out of bed.
That's a good time. It's perfect.
Yep.
Okay. I'd like to listen
Let's
to.
go.
I'd like to listen more to it tomorrow. So, yeah, great. Thank you.
Yeah, and the corrective action plan is in the in the audit package.
Yes.
So
Okay.
and look at. Anything else, Commissioner?
Nope.
All right,
set.
we'll go to Commissioner Dobb then.
No questions at this time, but I will, I'll be at audit tomorrow. So
Yeah, we'll both
that's
get a
it,
shot.
since
Yeah.
I'm vice chair.
Yeah.
Okay, thank you.
All righty, Commissioner Anderson.
Nothing at this time. I'll try to,
Okay.
I'll probably have some questions tomorrow at the audit. I just want to, I appreciate the work of the Auditor General. Thank you.
Yeah, I wanted to make sure folks had a little bit of an overview of that today without going deeply into it. Vice Chair Baker McCormick, questions to you.
No questions. Thank you.
Okay. I have a couple of questions here. One of the big issues here with this contract was staffing, and particularly the nursing. Just for a little bit of history, when the county was doing all of the jail health, and we had our own employees doing that, we always struggled for having enough nurses. And that was a struggle early on with what was then CCS, which is now WellPath. And now that we have COVID, because the thing WellPath had said was, well, we got this, we're nationwide, we got this pool of nurses, and we will always have enough nurses on staff. So I'd like to inquire, in these COVID times, have they been able to keep up on having a full nursing staff over there?
I am going to defer to the jail health administrator for that. He will know, have that information. His name is Dr. Keith Dlugokinski. Sorry,
Yeah.
I massacred his name.
It's Dr. Keith. We know. And I guess along with that, Doctor, are they meeting their numbers under the contract?
Yeah, good afternoon, Chair, and everybody else. To start with the first question, WellPath has made the staffing requirements in the jail since the outset of the contract, with the exception being the third quarter of this year, marking the onset of COVID. The third quarter being April, May, and June.
Right.
The staffing requirement, as languaged in the contract, is 103.6 FTEs. And again, WellPath has been meeting that. With the onset of COVID, the average for the third quarter has reduced to 72.6, which is a significant reduction from what had been roughly an average of about 100 FTEs relative to the 103. The caveat there is that the jail population has reduced roughly 50% with the onset of COVID, from roughly 1,800 down to 800 or so. I think now we're back up to right around 900. So we've had about a 20 to 25% reduction in staff, but the average daily population has reduced approximately 50% to offset that total.
Yeah, we really don't have a provision in the contract for that, right? As the number of folks in our custody changes, how does staff have to change? Doctor, you're there every day. Given these reductions, both in the number of people that the county is keeping as their guests, as well as the number of nurses we're able to get, do you have any concerns that there's not enough medical personnel over there?
The short answer is no. I think WellPath has adapted well to the overall, COVID pandemic, and making sure that all clinical services remain delivered as we would expect. And in addition, have been a partner and participant in the overall COVID, intake, testing and subsequent testing with respect to management of, that particular virus in the facility. So they've partnered with us around that as well.
And as long as we're there, you kind of hinted at it, because we have to do all this testing and everything now. How has the jail medical services changed here in the time of COVID? I imagine we're doing more things than we did before, disinfecting. I don't know. How has the jail medical services been different?
So I'll make a comment and then kick back to our clinical services division director to talk a little bit about the testing specifically, because she has been very intimately involved in that. But all standards of care have been, maintained as a primary focus. And as I said, some additions have been added to the scope around the COVID-19 virus, the testing, and how the WellPath team is facilitating in assisting not only us in the department, but the sheriff in managing that. So with that, Jennifer Caruso, you could talk a little bit about the testing and how we've been managing that at the jail.
Sure. So we have two separate things happening. So we have a newly booked inmate testing program that Memorial Health is coming in and administering the COVID diagnostic and antibody tests. We have tested approximately 2,700 newly booked inmates. That was as of 9/17. We have so far 21 positive PCRs, none of which are currently housed in the jails. So all of those individuals have either been released or are no longer COVID positive.
Let me stop you, Ms. Caruso, because you used
Sure.
this biologist loves it, but maybe not everybody. The PCR, that is what we commonly refer to as the test for COVID, correct? That's what
That is
people get when they put a swab up their nose to see if they have it.
Yes, diagnostic.
We don't need to get into polymerase chain reactions, but yes, that's for the presence. Okay, thank you.
Sure, sure. And with that testing, we quarantine the individuals, and in 14 days, if they're negative, right? If they're negative, they're quarantined for 14 days. We test them again at that 14-day mark. WellPath staff come in and do the 14-day follow-up testing. So far on record, we have about 350 to 375 tests that were administered on the 14-day follow-up, and that is by WellPath. WellPath has been communicating with us frequently about results. We give them lists every day as to who needs to be tested. So we've really identified a good way to communicate all the needs around the inmates and COVID testing with WellPath. As you can imagine, this kind of struck us quickly, and we had to quickly develop a plan to get inmates tested and to comply with Judge Timothy Kenny's order. So it was really just a lot of heads coming together and a lot of hard work to make this happen and do it on time and keep the monitoring sound throughout this process. And WellPath has been working with us to make sure that that's happening.
Have we had any community spread within the jail?
No, I do not have any knowledge of any spread within the jail, no.
That's actually pretty remarkable. I think given the times and given the how this is easily transmitted as a virus, I think that's pretty remarkable, and it says something about the county management of that facility. At a little bit of a higher level, well, is there any problem with healthcare requests from folks that we have in the jail being responded to in a timely manner? Nobody's waiting 8 hours, 12 hours, 24 hours to get medical.
I will defer to Dr. Keith on that.
Thank you, Doc.
Yeah, good afternoon again, Chair, Commissioners. The answer is no. The expectation through this whole entire pandemic has still been the previous standard, which is that requests for care are triaged within 24 hours. That is one of the things that we monitor on a regular basis, and that system is still in place and has been effective. It is absolutely the expectation that the requests for care, or kites as they're kind of known in the jail, are managed, triaged, and responded to by the healthcare team within 24 hours of service. It's by a nursing staff, and then subsequently, if a doctor or provider is needed, the inmate is referred.
Thank you, Doctor. I have one more question at a higher budgetary kind of level. Since we cut jail population in half, you know, the question is, what about our medical costs over there then? Now, I do know, I'm on the board over at DeWin, that the Mental Health Authority provides about $5 million a year for jail health, and that's been cut by $1 million. Well, it's been negotiated, I guess. So there's $1 million less income. Is there anything else in the budget? Are we going to be paying WellPath the amount in the contract for, you know, now that they're at about half nursing level? What are there costs other than what I referred to from the Mental Health Authority? Are there other costs that are reduced, or other incomes that are reduced because of this?
Sure, I can speak to that. It's Jennifer. So our off-site expenses, as you can imagine, with the reduced inmate population, have gone down pretty significantly. We can expect to see that through the upcoming months as well. I believe we have a savings in the management fee as well. We were able to negotiate a reduced rate on the management fee. We're saving $382,000 in that alone for the upcoming contract.
Can you give us that as a percentage of the overall fee?
I believe it's about 10.6%.
Okay, thank you.
You're welcome. And
Jennifer,
Dr. Keith,
how
I don't
much-
know if you have anything else to add as far as the finances are concerned.
Jennifer, this is Janelle. Why don't you respond with regard to what is the projected budget, the reduction in the budget this year compared to next year?
Sure. So the savings to the county for this contract year is approximately $4.7 million.
Out of a total of, I hate numbers all by themselves. They don't tell you anything. You gotta.
I'm sorry.
This is Dr. Keith. The previous budget prior to this upcoming renewal was $19.1 million.
Yes, correct. I'm sorry, this is Finance Director Kamal Kaparu, but you got it. So I'll go back on mute now.
No, well, not too quick. What
Okay.
is the contract going to be renewed at? Well, not renewed at, but the final 1 year option. What is going to be the total cost there?
14 million.
So that's what you're referring to, Doctor, huh? Yeah. Okay, great. And I know some of the recommendations of the Wayne County Jail Task Force have kicked in. I don't know if some of the recommendations coming out of the state that has their own task force have kicked in. But hopefully what we're going to be seeing is we're going to stay at these lower levels as we keep our jail population to a more reasonable number. Anything else on jail costs that you want to share? Okay.
I did not. Those were the key points that I had, the reduction in the management fee and the savings, the overall savings with 19.1 to 14.3. I don't think I
Okay.
have anything else.
Well, I'm going to go back then before we formally take a vote or something. Because I've been jibber jabbering here for a little while. Any commissioners have any questions at this point that they want to put forward?
I have a question.
Commissioner Marecki.
Thank you. And this has nothing to do with budget or anything, but somebody mentioned the other day that about a new COVID test that might be coming up that scrapes the inside of your cheek. Does anyone on the call know anything about that?
I saw that, Commissioner Marecki.
Boy, that'd be a lot better to have that.
Yeah, they're
Than
a
the other
little
one.
concerned. I think a few universities, I think it was actually a university that developed it, because they're like testing their people like every other day at that school. It was somebody at the, I don't know if the efficacy of that test has been established, but
Okay.
but I
But
think
they're
we
looking
can.
into it.
Yeah, I think, Commissioner Marecki, I think we're going to see a lot of this going forward.
Yeah.
Because
boy.
you have research institutions, but you also have people like in private business that think they're going to ring the bell and, you know, we're going to have the greatest. So, but on that one, I know it's being used. I don't know the efficacy.
Okay. Thank you.
All right,
Hopefully
Commissioner
soon.
Baker McCormick. Look,
And this is Carol Osterberry from the Health
Oh, yeah.
Department. And yes.
what would the health
Commissioner-
officer know about this?
Right, Commissioner Killeen, exactly what you had said is what I'm also hearing is that, you know, more and more tests methodologies are going to be coming out this fall, that is going to be the next, you know, wave, and we are staying apprised of them. I, you know, would have to look more into that one specifically, but that is what we are seeing and hearing, you know, from our professional, you know, society groups and the state. So exactly what you said is, you know, what I can just add to that. More and more testing and different specimens are going to be coming out for COVID-19.
And we're counting on you, Ms. Osterberry, because if I can quote my former executive director over at the Mental Health Authority, when it comes to COVID, as the plane is going, we're still building the plane as it's going down the runway. So, you know, a lot of this stuff is happening contemporaneously and hard to keep track of for what is. I see you, Commissioner Anderson, but I think I heard Commissioner Baker McCormick. Did you have a question? Then I'll go to you, Commissioner Anderson.
Yes, there was last year a report that was being done, or there was WellPath was being monitored to check on the process of. I was trying to remember what it was, but the employees, there were some issues with the timesheets and issues related to that. Does anyone recall that? With the jail issues? No? Okay.
I will let Dr. Keith respond to that. Keith has been actually working closely on that, so I'll let him respond.
Yeah, it was
And
some
just to
issue
clarify,
with employees and their timesheets, and
Yeah.
that was being monitored, and I just wanted to get an update on that.
okay,
Yeah,
Commissioner
yeah,
Baker
so-
McCormick, I think you're referring to maybe an issue that was raised during the OAG audit.
Right.
Yeah.
So, Dr. Keith?
Yes, that's correct. That was one of the corrective actions that Jennifer referred to earlier, that we are monitoring, and it essentially had to do with productive versus non-productive hours toward the total of FTEs that were required by the contract. Again, 103.6 FTEs being required by the contract, meaning that those were the productive hours that needed to be worked in the jail facility. So you could not count things like vacation time, sick leave, FMLA toward the productive hours. So we have instituted a verification or validation of productive versus non-productive hours as they're reported by WellPath. We pull a random sample to determine the productive versus non-productive hours with regard to compliance with respect to the contract.
You have the floor, Commissioner Baker McCormick.
Muted myself. Has that changed since COVID? The way in which you're monitoring the productive versus non-productive hours?
No, that has not changed. The same criteria apply to determine productive versus non-productive hours.
Thank you.
Commissioner Anderson.
Thank you, Mr. Chair. Just a quick question. The cost of this contract, how much of it is based on jail population? And have we seen a commensurate reduction in the cost of for the extension of the contract does it reflect the prison population? I think I heard somewhere that we're almost half the prison or the jail population that we were a year or so ago.
Yes, I will allow Dr. Keith to answer that question.
Yes, again, Dr. Keith with the department. Commissioner, yes, this renewal does absolutely take into account the reduction in the jail population. As you've already heard Jennifer talk about this afternoon, the total value for the contract has reduced from 19.1 million to 14.3 million for this upcoming year, specifically related to the average daily population of the jail, understanding and expecting that overall costs across the board and most all of the line items will be reduced because of the reduced average daily population.
So one would wonder why, if the population of the jail has declined by about 50%, it looks like we're getting about, what, 20 just under 25% reduction based on the jail population.
Yes, that's correct. So one of the things that we have done in the budgeting for the upcoming year is to anticipate perhaps some uptick in the population as we kind of get through, the pandemic and a little closer to maybe the previous ADP. So we've built the population.
Average daily population, Doc?
Pardon?
Average daily population?
Yes.
Not some security firm for your house or?
No.
Yeah, well, we're in a public meeting with folks out there. The alphabet soup is what I'm commenting on.
Yes.
Thank you, sir.
So, we anticipate that there will be some uptick in the average daily population of the jail as we proceed through this upcoming fiscal year. So some of the estimates in the different line items were made to accommodate what might be in the end all, 1,100 ADP, which is less than what it is that we're seeing now. So
this is Janelle Allen. To Dr. Keefe's point, that the actual, other than the management fee, which is fixed, the other costs are actually dependent upon actual costs. So if the costs are less than what we have estimated, we will not pay. We're not obligated to pay what the estimated, it's the actual cost.
Okay. All right, thank you.
So that means, Ms. Allen, that there is some sort of a cost settlement that takes place.
Exactly, yes.
Between
and
the
Dr. Keefe can
county
address
and-
that. Yes. Dr.
Yeah.
Keefe, will you explain how the reconciliation process, or Jennifer, goes on a monthly basis?
Yeah, so also I just want to, I think this will help too, Commissioner Anderson. So in 2017, for example, we budgeted 14.4 million. Our actual costs were only 11.1 million, okay? In 2018, we budgeted 19 million and our actual costs were only 14 million. In 2019, we again budgeted 19.1 million, but our actual costs were only 18.3 million. And so far in 2020, we are right now 7.5% under budget, and we only have one more month to go in the contract. So it shakes out in the end. And if Dr. Keefe wants to elaborate on that, if you require more information, he can do so.
Just to Janelle's point, the costs are passed through. So regardless of the budgeted amount, in this case, the 14.3 million, we will only pay actual costs. So if it does turn out that they are less than that, we will pay only, in fact, what is spent across the service.
And does that money flow back and the excess flows back into general fund?
I believe it's credited to the county. Exactly where it goes, I would have to defer to the finance group.
Okay.
Yes, this is Kamal Kepru, Finance Director. Yes, a portion of it does. But I want to go just a little bit further. There's a reconciliation every quarter, and that was a couple of the points in the OAG report. So every quarter we do a reconciliation of the financial data. And one thing that came up in the report, wasn't verifying. So now we're actually verifying that we're not being overcharged in certain areas. So when Ms. Caruso brought up those points about the savings, now we have a process to just verify to make sure that we're not being overcharged. Not saying we was before, but there is a process in place, and we reconcile quarterly. On a monthly basis, what WellPath sends us is just their monthly expenses projected. And then what we do on a quarterly basis, go back and just touch it and ask for receipts and so forth and so on.
Very good. I think it gives maybe everyone, including myself, a little better explanation and understanding of what, how the costs are actually calculated and adjusted. Thank you.
Thank you, Commissioner. And I just want to comment here. It's almost 4 years now that CCS WellPath has been with us. Folks will remember kind of how traumatic it was to privatize this service 4 years ago. We had many conversations about it. And then I think with the OAG's report that came out about 1.5 years after they started, and administration's response to it, you know, these are folks that we are legally responsible for. And I think the way everybody that's from staff here, that's here today, and the commission and the OAG has worked together to make sure that our jail health services are up to snuff, I think has been very good. Problems were pointed out and problems have been taken care of because, again, these are human beings in our care, and getting it done right is very important. And I think everyone is in agreement with that, and everyone has gone the extra mile to make sure that has happened. So what we have before us is a proposal to take the second year of the 2-year extensions to the contract. And so the contract will be over after this, and RFPs are going on now. So what's the pleasure of the committee in terms of taking the second 1-year option on this contract?
I'll move approval, Dobb.
I'll support.
Commissioner Marecki, support. Commissioner Dobb moves, Commissioner Marecki supports. Any further discussion before we go to a vote? Hearing none, all in favor of the motion before us, please say aye.
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 All opposed, please say nay. Are there any abstentions? All righty, thank you all. Madam Clerk, I believe we are going to the addenda.
Yes, do you see it on your screen?
And what is item D3, please?
Item 3 is a resolution by Commissioner Baker McCormick strongly urging that all children in Wayne County be tested for levels of lead in their system, that data sharing be implemented so that all partners throughout the county and state of Michigan can better coordinate prevention and lead remediation services, and that the lead renovation repair painting program be enforced.
All righty. Now, I believe, and staff tell me if I'm wrong, Mr. Rainwater or whatnot, I believe Commissioner McCormick's original resolution was sent out to committee members.
Yes, I have that to put on the screen for you.
Yeah. Well, I think people have seen the original one. The reason it got held up was just this very step here, to put it in form of a resolution and formal. But I believe everybody received this. Is that correct? Not this specific one, but they received the verbiage.
Well, Commissioner Killeen, just
I'm just going to turn it over to you, Commissioner Baker McCormick. So
great,
just take
great.
it. Yep.
Thank you. Thank you. First of all, I'd like to thank D-LED for helping with this resolution. I met with them some time ago, and this is a group of parents who are truly concerned about lead in particular in homes that were built before 1978. And so when I met with them, we talked about how some of the issues around lead and in particular to construction or remediation of lead, some of the rules of enforcement are not being applied. And so this is where this resolution came, or why this resolution came about. However, I just spoke with Chair Alicia Bell, and she notified me that actually notified me today that there is a ordinance that she introduced in 2003, in fact, that is similar in nature. And so I did want to give Ms. Mary Sue the opportunity to talk to the issue of lead and why this resolution, as well as the ordinance that Commissioner Bell sponsored, should be in place. And what we'll do is we will look at another time, well, not today, we'll look at how this ordinance and the resolution that I'm presenting today overlaps, and we may have to revise it to talk to what we wanted to say and not repeat the same ordinance or resolution. So
there's no harm in repeating it, right?
Okay.
An ordinance and a resolution, two different things. But
okay.
But I do, Commissioner, I do think, you know, the way it's on the agenda, this was up first and then discussion with DLED. I think I'll take I think I'll take the privilege. Let's have the discussion from DLED right now.
Thank you.
And then that forms the basis for, you know, any further discussion of ordinance or resolution or whatever you want to do there. So I know you have some folks there with you. Commissioner, would you like to introduce them? Well, virtually there with you, Zoom there with you, whatever. Unmute yourself.
Hi, if I may. Hi, my name is Iselda Esquivel, and I am part of the DLED group, which is the Detroit Lead Advocacy Parent Group. Just quickly, I want to introduce myself. I do have a few with me, parents, so I'll let them introduce themselves. But I'm also a parent of 2 children. I live in Detroit, and I'm a parent advocate as well. Just to give you background on some of the issues that our group has been focusing on and discussing. We are members of, obviously, the DLED, Detroit Lead Advocacy Parent Group, and we're calling for improved education, policies, funding, and enforcement on lead issues. Most of our members have children or grandchildren who have been lead poisoned or have had elevated blood lead levels. Lead poisoning in children causes, as we all know, lifelong difficulties, including decreased cognitive capacity, slowed learning, impaired hearing and speech, tendencies towards hyperactivity. In 7 Detroit zip codes, over 1 in 10 children have lead poisoning. In the zip code 48206, nearly 18% have lead poisoning. Highland Park has a child lead poisoning rate of 14.8%, and in 2018, 311 Wayne County children were lead poisoned in Dearborn, Canton, and Westland, among other communities. Children who have experienced lead poisoning are 7 times more likely to drop out of high school and 4 times more likely to enter the juvenile criminal justice system. So we're asking the Wayne County Commission to consider passing our resolution as submitted by Commissioner Baker McCormick, which contains the following request. And this is where I'm going to let the parents speak on these topics.
Would you like to introduce them?
Yes, I have 3 with us. We have Miss Tanisha Henry, we have Miss Sierra Cole, and Miss Minnie Lester. And
Minnie
I'd
Lester.
like for
Minnie Lester. Holy cow.
Yes,
Okay.
she's a great advocate. If we have Miss
kind of
Tanisha
what she
Henry
does.
still with us.
Yes, I am.
If we have Miss Tanisha Henry, you can go ahead and speak on one of our priorities.
Okay, can you hear me?
Yes, we
Yes.
can hear you.
Okay. Good afternoon, everybody. Thank you for allowing me to speak. First and foremost, my grandson was diagnosed with extremely high lead levels at the age of 4. He was tested at 4. I personally think he should have been tested earlier. His lead levels were 21. He is now 8. With him being 8, he is quote unquote aged out. So the question is, I'm sorry, Taniccia, Taniccia. He's quote unquote aged out, which means there aren't really any, there's no help for him. There's no, I mean, you know, when he first was diagnosed, there was a nurse that came out on a monthly basis. You know, we talked, we had the house tested. My house is 100, well, next year it'll be 100 years old. I'm right outside the Boston Edison area, which is 48206. And with that being said, what happens to the kids as they get older? What can we do to help guide those kids? Because realistically, the conversation you had right before this one was about the correction system. I don't want to see these kids in that system. He does have problems learning. He has comprehension problems. And I don't know. At this point, we're lost on what to do. I don't know what suggestions I can give other than, is there a way to change the age limit and require children to be tested much earlier? I feel like getting them young will at least lessen the problem, make it smaller.
Yes.
Because he wasn't tested until he was 4.
Right. And we're looking to advocate on universal testing for all children in Michigan. Because currently right now, they're only testing children that have Medicaid right now, unless they're referred by a physician. So we're looking to have this universal testing for all children in Michigan so that it's just a unified, every child gets tested. So we're looking to advocate for that.
And this is Mary Sue. I also work with Izelda. I would just add that in Tanisha's case, if her child had been caught, his lead level had been caught through universal testing at age 2 versus age 4, his outcomes would have been substantially different. So we really are looking for an advocacy around that change.
Yes, and I think this is what this resolution talks to, is reducing that age to under 6 years of age and for all children.
Right.
And just a standard test for when you go to when we have our children tested and they go to the doctor for other tests and immunizations, this should be part of what is standard practice. Thank you.
Thank you. And we have our next parent, Minnie Lester. I'd like to give her an opportunity to talk on the second topic we've chose.
Good afternoon, commissioners.
Good afternoon.
I want to ensure that the renovation projects, that the contractors that disturb the lead-based paint will be done with lead-safe practice. When they go in and do the lead, we want to make sure that it's safe for the people that's there. Proven to reduce the lead exposure by urging the state of Michigan to enforce the EPA lead renovation, repair, painting, program. We need to have that done. I have, I should have introduced myself. I'm sorry. I know Commissioner Colleen, he already know me, but I'm president of Southeast Waterfront Neighborhood Association. I have grandkids and great-grandkids. Thank God I don't have any that have the lead poison, but I really enjoy being a part of this program because I want to ensure that all children be tested. I think that someone suggested that, you know, when they go to the doctor, I think that was Commissioner McCormick, that the children be tested for lead at a very, very early age. And that way we can catch that and we won't have all these deformities and have the children with problems. We have enough problems out here now. We don't need kids to have more problems coming on as they get older. Thank you so much for letting me be able to speak, and thanks so much for letting us come into your meeting.
Thank you.
To everybody that came to speak today, including you, Ms. Lester, you don't have to thank us. That's our job. We're thanking you that citizens come and talk to us about these issues. You always have access. You don't need to thank us. You're our boss. And that's the heart and soul. That's the heart and soul of Jefferson Chalmers neighborhood right there. Anything else in terms of a presentation?
And if we, yes, we do have one more parent that's here to speak with us. Her name is Sierra Cole, and she'll just mention the last topic we wanted to talk about.
Okay.
Hello.
Hey.
Hi.
Hi, I'm Sierra Cole, and I have a 4-year-old and a 6-year-old. They both, well, first I would like to thank Commissioner Baker McCormick for bringing our resolution to the commission. And so I have a 4-year-old and a 6-year-old boy and girl, both caught lead here in the city of Detroit when they were 3 and 5. So my concern is that no child is left behind for lead testing and services, because I do understand it's an age limit up until age 6. So also I would like to ensure that more adequate funding is available in the Wayne County area for all children. Also for renters as well as homeowners. I know that it's slightly a difference for each family. Some families are renting, that's a temporary situation if they move, or so if all the homes in the area was treated at a greater, how can I say, if it was just greatly, you know, important to, you know, for us to fix this problem, then each family that move in that house for future, if they have children, the children will be safe. It won't be like a hit and miss.
Right.
Thank you.
Thank you.
Mr. Chair.
Yes.
Commissioner, can I have Ms. Allen chime in on this discussion to comment, any comments you might have or suggestions, or what we are doing versus what we might be able to do better?
And if our health officer, Ms. Osterberry, could also weigh in on that, please.
Actually,
I
that's
will
exactly
also,
true.
Yes.
just from a management point of view, real quick here, can we move that resolution up one page? We've been looking at the whereases for a while. Can we move it up one page to see the punchline with the therefores, the resolves? Thank you. Ms. Allen?
Yeah, actually, I was going to defer to Health Officer Carol Osterberry because our lead-based paint program is in our public health division, which she oversees and I know is intimately familiar with. So, Carol?
Yes, thank you so much. And yes, lead and lead-based paint and removing, you know, lead hazards from children. I will tell you from my personal also experience, when I first came to Wayne County, I quickly got involved with, I quickly got involved with our HUD lead grant, and it has always, it's just the wonderful stories. And Mary Sue, I've known her for years and worked on, working with families, working on with children to, identify the lead-based paint issues and then the effects on the children. So we do have a full-time public health nurse who that is her full-time job every week, is getting the download of all of the cases of children that have elevated blood lead levels in Wayne County.
How do we know
and
who
then
has
does
elevated
case
levels? I'm
Pardon
sorry,
me?
Ms. Oster. How do we know who has elevated levels, Ms. Osterberry?
Right, and that is any child who is tested, and as the former participants on the call have said, that all the children who come in through WIC, they are tested. And then at pediatricians' offices, testing happens. So through the public health division, and again, that nurse that I have that I just talked about, she even will go out to the Head Start, offices and agencies and do testing, help with also back to school testing. So I hear exactly what a lot of the others have said about that there needs to be no more testing, and that is true. But like I say, we do, especially through WIC, all of the WIC children who are enrolled, that is part of their initial questionnaire and screening is, has your child had a lead test? If not, we can collect it right here and have it sent to the state for analysis. So again, and she follows up on any child that has a blood lead level equal to or greater than 5 has full case investigation completed by the Wayne County Health Department. Then we also have an environmentalist who is certified and trained in going into the home and then identifying where the lead-based paint hazards are in the home. So when that field visit happens, many, many times, the field visit is happening with both our public health nurse and our environmentalist out in the home. And it's a very important, it's very good for us to be physically in the home, see the family, see the children, how they exactly how they're living in their house, to really be able then to identify where those lead-based paint hazards are. And then that last step is then getting those lead-based paint abated or removed from the home. And that, our program can do that. We also have Mary Sue through ClearCore has Healthy Homes program, and then the state has Healthy Homes. So that is the ultimate progression of when a child is identified with elevated blood lead levels, and then how you worked with the family, with the child to identify what the source of lead is, and then eliminate that from, their environment, from their world.
A couple of clarifications here, Ms. Osterberry. The city of Detroit has their own funding source for lead abatement. So Wayne County does not work inside the city of Detroit.
That is correct.
And so we work everything else, like Highland Park and Canton and everything else.
Yes.
Does the funding for our lead program, where does that originate?
We get funding, like I said, for that public health nurse, that comes from the state.
So I think in the discussion here, the resolution is good before us, but we really also need to talk to state reps and state senators and perhaps a governor about what kind of funding is coming out of Lansing to help local communities. Ms. Osterberry, do you have any idea what % of kids are being tested? Let's say,
Right. Unfortunately, I do not. I apologize.
Yeah, but it's a small percentage, I would think.
Yes, this is Mary Sue Schottenfels. In Detroit, we know that only 34% of children are tested. We know it's far lower in Wayne County. Unfortunately, that's not a statistic that the state makes public anymore. But we know it's in those outer communities, it's far less. And we know that the lead poisoning rate in the county is less, but there are definitely pockets of fairly high levels of lead, including Highland Park and in some of the outlying communities like Dearborn, for instance.
Do you have
Right.
a map of that, ma'am? Do you have a map of those concentrations?
I'd like to introduce here Dr. Mike Thompson from Wayne State, who helps
Oh,
with
okay.
the DLED project, and he is the guru of all things data and maps.
Great.
So I could put together a map that would show you guys what the lead levels are in each of the zip codes for the County of Wayne. That's not a big challenge. I can get that to you. The second thing I would point out is that the lead level, the testing levels in Outwayne are somewhat lower than they are in the city of Detroit. We don't know the exact levels, but we could find that out from the state. We've asked, but haven't gotten it yet. The third thing I'd make a point of is that during COVID, the WIC locations are not doing testing. So the testing levels are going way down. Testing levels are in the range of 20% of what they were before COVID came along. So in other words, if the lead testing rate in Wayne County is 30%, then it would be 20% of that now. So what, 5 to 10%, somewhere in there. And so lead testing is a really significant issue because it means that there's a lot of kids out there who may be lead poisoned, but they're not tested, so we don't really know how many kids are lead poisoned. And so that's why it's such a prominent issue in what we're asking you all to look at. I hope that helps, Commissioner.
It does help. And as an old science teacher myself, you see stuff graphically like on a map, it sticks with you a lot longer than 4 pages full of numbers.
Right.
I do want to go around the horn. Anybody else presenting? I want to get commissioners' questions involved.
Excuse me. Excuse me.
Yes, ma'am.
Hi, this is Miss Henry again.
Yes, ma'am.
But what I noticed in everything that was just said, and the problem that I had was I worked. I wasn't on Medicaid, so it wasn't required. It's only required pretty much super low income, and I never had WIC. So I had to pay cash, and I'm just thinking of people like myself that are above the threshold to get WIC or get Medicaid, and they have private insurance. Blue Cross doesn't require it. So who know? They don't know. The parents don't know.
Right.
That's why it's such a big thing that every kid needs to be tested.
Well, I think we're
Ms.
lucky. Thank
Osterbeck.
you.
I'm sorry.
Mr. Chair.
Go ahead, Commissioner.
I was just going to clarify or ask Ms. Austenberry if she can clarify when she talked about the pediatrics tests. Is that a standard, or even the doctor? Is there some standard tests?
The blood test is it's a capillary test. Now, as far as pediatricians, I mean, they certainly, as has been said, they certainly can order to have that test collected, yes. But as far as, what everyone's been talking about, having it being a required test for, children under the age of 6, I don't think that, that's part of this discussion. But yeah, the test, it's a very simple, they stick the child's finger and just take a little bit of blood through a capillary tube.
Okay. And so what does treatment look like?
Treatment of the child?
Yes, especially if you catch it early versus catching it later in life.
Right.
What's the difference there?
Right. I mean, it's working with the child, and if there are any sort of developmental delays, But, you know, as far as their, you know, it's not like an actual like clinical treatment until a child is very severely, has a very severely high level of lead in their system, and then they actually have to go through chelation, and that's in a hospital.
So basically, they just live with it? Is that
well?
The
but that's my
standard?
right, where our public health nurse goes out to the home, and that's part of that whole assessment. And then if there are other programs that then the child can be then referred on to for further you know, work, there are developmental, you know, there are programs to assist families and children if they need more, you know, work with their developmental, you know, growth and development.
Right. So basically, again, there's no real treatment for it unless they're severely ill. Is that what you're saying?
For clinical treatment, that's correct.
Okay. So then that's probably even more reason why we need to catch it early than late. And then if you paint over lead-based paint, what does that do? I mean, it will encapsulate it, but does it remediate the issue? Does it help the issue?
Yes, because exactly like you said, it encapsulates.
Could I add, this is Mary Sue. The issue with lead-based paint is it peels and chips and chalks. So even if you cover walls or cover window wells or porches with a fresh coat of paint, eventually that paint will wear down, especially if there's going to be any movement, like a door shutting, a window going up and down, and that's where children classically get poisoned. So a fresh coat of paint helps momentarily, but as soon as that surface disintegrates in any way, from a leaky roof, a leaky ceiling, banging doors, kids banging on the porch with their shoes, that paint will disintegrate. And lead dust is heavy, it falls to the ground, and it's hand-to-mouth activity that kids classically do that creates a problem. And 90% of the houses in Detroit, and I think it's in the high 80s in Wayne County, were built before '78, and we pretty much know that all those houses have lead paint. So if we could,
Right, and to add what Mary Sue, oh, I'm sorry, Mary Sue, were you done?
if we could see more funding come into Wayne County, that would be great.
Right. And to add what Mary Sue has said, like she said, those, the surfaces where it's like the windows going up and down and the doors banging, that's why in many, many of these homes, the windows are what is, full window replacement is what is happening. It's not just the painting.
And there is no safe level of exposure, particularly for infants and young people?
Correct.
Correct.
Yeah. You know, I've mentioned this before. A million years ago, I was going to school up in Lansing, Michigan State University, and right in downtown was the Lead Paint Company. And then all of a sudden one day they became, as the, you know, early 80s and whatnot, and lead, all of a sudden one day they became the Murphy Painting Company.
Yeah.
As if an Irish name makes everything okay. I thought it was odd. Commissioner Baker McCormick, what would you like to do with the resolution? I don't see anything on here that would necessarily conflict. I know there's more issues have been raised here, but what would you like to do with the resolution today, Commissioner?
I move for support of this resolution.
Is there support? It's been moved.
I'll support Commissioner Daub.
Thank you. It's on the floor. Questions from committee members of either the resolution or our guests. I'll start, Commissioner Marecki. Do you have questions?
I just have one question. When the contractors go into these houses, do they actually remove the paint and then paint a new coat, or they just paint over it?
Would you like
Mary
to
Sue.
answer that?
Yeah, Mary.
When they go into a house, they will classically, as as Carol Osterberry said, remove and replace windows. They'll probably remove and replace door jambs. If it's a porch that's got lead, like an old wooden porch, they'll classically cover that porch with like luan and plywood.
Absolutely.
They really never just paint over surfaces. So they either encapsulate, which is like a thicker lead protector, or they encapsulate, they remove, or they replace.
Okay.
Just painting over, as I said, is an interim
Yeah.
solution. It's short term, and it just doesn't last very long.
Yeah, and sorry, I missed a little bit of the meeting. I had to get up and do something, so that's probably when I missed it. So are the main sources then of the lead for the kids, the paint and the water?
Water, Dr. Thompson, do you want to talk about water?
Water in Detroit, in the Detroit area.
And I mean the pipes. The pipes, I mean, more than the water.
Yes, and in the pipes in the Detroit and Wayne County area, in general, wherever the Detroit water system is working, is usually not an issue. It's because the city of Detroit, well, the water system puts in an additive that puts a calcium carbonate related, not exactly that form, but a substance that builds up on the inside of the pipes and protects from the release of lead into the pipes. It's only when that gets broken or eroded that then becomes available and comes in through the pipes and might pollute the water in a house. That can happen sometimes, for example, from big trucks going on residential streets where the mains and the water lines going into the houses are not strong enough to withstand those big trucks. It can happen in other situations. It happened in Flint because they put acidic water into water lines that weren't prepared for that at all, and those water lines, that acid just carved out the calcium carbonate, and it then made the lead available. So the water department here has long been cognizant of that risk and has always maintained that additive. It's not expensive, and it's used in all local water systems.
Okay, thank you for that. So it's primarily the paint then?
Yes.
Yes.
Okay, thank you. I'm all set, Mr. Chair.
Thank you. Commissioner Dobb, questions, comments on this? We have
No
a motion.
No questions from me. Thank you.
All righty, Commissioner Anderson?
The only thing I have is just a quick question about I believe this is a resolution is great, but it doesn't appear to require any action. It encourages, and maybe that's all we can do in this circumstance, but I would like to, maybe see it add something about pursuing additional grant dollars to fund the cost of this, to make sure that these children are tested and at an early age. And I don't know if we can put that in this or between now and the full board meeting when it's taken up, but I think we need to, because I know one of our colleagues is going to mention it sounds good, feels good. We know it's a good first step, but I would like to see us do something to encourage seeking of funds to make it possible to do this. That's all.
Thank you, Commissioner. And I would guess, Commissioner Anderson, that we have an advocate on the commission in Commissioner Baker McCormick on this issue. And she will be reviewing the county ordinance that was referred to earlier. Of course, it's a resolution, so we really can't require. We can make strong suggestions. But I would anticipate that this is not the last thing we're going to be hearing from Commissioner Baker McCormick on this issue, especially as we review as she reviews the current county ordinance on this. So we'll leave the last word to you, Commissioner Baker McCormick, before we go to a vote.
Again, I just want to thank the team here from DLED and Wayne State, the Dr. Mary Sue, and all of the parents that have been involved in the push for this resolution. And I agree with Commissioner Anderson that it should have some teeth in it. However, I'm not sure if that's something that we can do in this resolution, but I am going to look at the ordinance that we have and see if we can tie that in to this resolution to support for funding. In addition, I want to ask what, if anything, we can do, and I know it would, as Commissioner Killeen said, it would probably be through the state that we can mandate testing, what that might look like. And I don't know if there is anything on the state, in the state law that talks to testing for lead, but I will definitely dig deeper and make sure that we figure these things out.
Well, and I think, Commissioner, also a favorite state rep, state senator from around these parts, to have some sort of a, I guess these days, some sort of a Zoom meeting or a town hall where we can explore with the state in a public forum, you know, what the laws are and what needs to be changed up there, you know, all the funding issues and everything. Anything else, Commissioner Baker McCormick?
Just one other question. Do we know if there has been a push for mandatory testing for lead at all? Does anyone know of any such push?
Well, this is Dr. Thompson at Wayne State again, and I'm on the state lead commission, and that group has asked for universal testing to be passed into law. That has not been effectively brought before the legislature in a way that they've considered passing it recently, and so it's an issue that's being considered by MDHHS and is something that the lead commission at the state level would strongly endorse, has strongly endorsed, bringing before the legislature and getting their endorsement for.
Great. And if I can get your information after the meeting, if you can either email my office or call my office with your information. The office number is 313-224-0884. 224-0884. Thank you. Thank you so much.
Thank you.
Thank
so
you
much.
all.
Thank you, Commissioner. We do have a motion before us to approve the resolution by Commissioner Baker McCormick. It has been moved and seconded, so I'm going to go to a vote on it. All in favor of the motion on the resolution, please say aye.
Aye. Aye.
Aye. Opposition, please say nay. Are there any abstentions? Thank you very much, Commissioner Baker McCormick. This is a very large issue with many tentacles to it. So thank you for taking it on, because there is no safe level for kids. Okay, we'll go, Madam Clerk, what is next on our agenda today?
E, such other matters as may be properly submitted before the committee.
I have none. Is there anybody with some such other matters? Ooh, the silence is deafening, so we'll go to the next item on the agenda, Madam Clerk.
Public comments.
Have we received any email public comments?
No comments.
Okay. Can we perhaps unmute folks that are attending this meeting to see
Yes,
if, I'm sorry?
I'm muting everybody now.
Okay. So for the public out there, if anybody has comments to the Health and Human Services Committee, you got a couple of minutes on the floor to express your comments. This is indeed public comment, so it doesn't generate a back and forth conversation. If your comment means there has to be follow-up, that will be done outside of the meeting. But 2 minutes to comment to the Health and Human Services Committee. Is there anyone that would like to have public comment? Anyone would like to have public comment that's attending the meeting today? One last call. You are unmuted. Anyone with public comment? All right. We move the agenda, and I see that agenda item is called adjournment.
Move to adjourn.
Commissioner
Support.
Anderson moves, and it's supported. So without objection, we stand adjourned. Thank you, everybody.
Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you very much.
Yeah, good stuff.